I'm originally from Connecticut. I came to California to study medicine, and I'm going to be a physician assistant. It's been one of my goals for a very long time. I've always been involved in healthcare since the age of 16, and this is what I'm meant to do. I applied for the scholarship to take advantage of a lot of the opportunities that were given here at Touro from our faculty and advisors. For the second diversity scholarship that they've ever had, I'm really honored to have received it. Scholarship, to me, gives me more motivation in the sense that there are other people that are believing in what I believe in. So it's nice to know that I'm going to an institution where they believe in my goals and my success. My family's originally from India. I'm actually a first-generation college student and the first in my family to go to college, so I'm very excited about that. Being the first child in my family that grew up here in America, I had to translate a lot, and a lot of translating included maybe going to doctor's visits with my grandfather and grandparents and mother and father and things of that nature. So I got exposed at a very young age to a career that I saw direct impact in people's lives. So at 16 years old, I started working at a nursing home. And eventually it got me able to sift through the different careers. I wanted a career that was very flexible and had a lot of responsibility. So that's what led me to choose what I'm choosing right now, is to be a physician assistant. What I want to do is work hands-on clinically in the field and go on to maybe educate a larger sector of people. Throughout my studies and throughout my involvement in science, I just still to this day feel like we as a society are not as educated as we should be in taking charge of our health, and I want to be one that changes that.
Sagar is a people person, so when you meet him, you connect immediately. He is genuine. You can see that he cares about you. He cares about his work and what he does. He wants to help.
He's very kind, very humble, and he can relate to a lot of the patients. He comes from an underserved background, and so he always kind of ties it back to him, like what he went through. And so patients, I feel like they can understand him, and they have that sort of respect for him.
What this program brings that a lot of other programs do not bring is a dual degree with a master's in public health. In a little bit of a longer time than other PA programs, I'm able to get an extra degree, which I can do a lot with in the future, and that was very appealing to me. Currently, I'm a student on rotations. I'm in my second one so far, so I did cardiology and now I'm in surgery. Being on rotations and having that hands-on clinical experience really drives me day to day. It boosts my professionalism. It makes me just value the amount of work that I get to do and the reasoning that I'm doing it for. Something that's very unique about my physician assistant program is how accessible the staff is. So I've taken on a leadership position here in my program, and I've gotten to develop a relationship with the faculty that I thought I was not expecting once I came in as a student. So it's not necessarily just going through the motions of the program, it's actually developing relationships and having transparency of your future career. Touro University has really given us the skill set and the knowledge to be competent and confident providers for the future. So we're all coming out of here in a relatively short period, grinding through a very tough program, but at the same time, we're going to be out there in the field as healthcare professionals and becoming very successful at what we do. So Touro University has definitely given me that sort of confidence.